a subject, and this is what you see in the type of study. Now you can say that my using the internet or using the screen, my screen time is to that extent that it leads to sleeplessness in me. But you cannot say that this this attribute of mine or this activity of mine is the cause of my sleeplessness. There might be many other causes. I might be consuming caffeine. I might be stressed. There might be many other reasons associated with my sleeplessness. However, you can always say with when you have the data, when you make interpretations, you can say safely that you have an association between an activity and the end result. So this is what we'll talk about. So what is data interpretation? First of all, I would like to inform everyone that Dr. Saima Zainab was initially supposed to take this presentation, but she's on leave, hence I'm taking this session. And in between the session, I'd really appreciate if you could send me your any queries. At the end of the session, when I upload the presentation on Edmodo, and also during the assignment, you can always send your queries. So data interpretation is the usual step, and after that we go towards data analysis. So when you analyze, you have a data set. Data is the information that you derive from the numbers, and then you interpret that data. That is very important, because it's of no use collecting data and not interpreting it. So what is interpretation? It involves attaching some meaning and significance to the analysis, explaining the descriptive patterns, and looking for relationships and linkages among descriptive dimensions if they exist. So if there is a relationship, you will express it, you will define it. That is known as interpretation. If there's no relationship, you will also define that. So once these processes have been completed, the researcher must report his or her interpretations and conclusions. So your conclusion is very important. You must interpret your data and conclude what is the end result of your entire activity. So the importance of data interpretation is evident, and this is why it needs to be done very, very rigorously and properly. And what's the purpose of collection and interpretation of data? It's to acquire useful and usable information and to make the most informed decisions possible. For example, if you're working on students, let's say, and the anxiety now that students are coming back, or whatever, you're talking about COVID-19, for example, you're talking about what students know about their knowledge, attitude, and the practices of that they follow for the prevention of COVID-19. So this piece of information that you will collect, once you interpret it, the readers for the coming generations will be looking up to that data. They'll be seeing your decisions, they'll be seeing your interpretations, and they'll be using the same, they'll be using it as an assumption. Whatever way you collect your data and your interpretation, whatever conclusion you reach to, they will be taking that as an assumption, like in this sense that they'll be saying that this study exactly showed that the students had a higher level of knowledge regarding COVID-19 prevention, or regarding the SOPs for COVID-19 prevention. However, their practices were limited. For instance, I'm just giving you an example. Then they will judge your practices and they'll compare your practices with theirs whenever, if anyone else does a study on the same subject. So you review your data for patterns, for trends or themes that help you to tell a clear and compelling result of your research. So that's the most important thing of doing research. And the results that come together, they give an overall picture of your research by drawing to conclusions. And conclusions answer the evaluation questions and describe what you have learned from the entire exercise. So we all know by now that there are two broad types of analysis, this quantitative and qualitative analysis. So when we interpret data, an analyst must try to discern, to differentiate between correlation, causation, and coincidences. So something might happen because of some factor, and it might just be a coincidence. It might not have caused that effect. So I'll be giving examples after that during this session. And there are biases also. Bias means that you have it's your tendency to go to incline towards one factor when that factor might not be so important. But the researcher also has to consider all the factors that are involved or may be involved, and that may have led to a result. So data analysis and interpretation, regardless of whatever method you're using, qualitative or quantitative, they include the following characteristics: the data in identification and explanation, comparing and contrasting of data, identification of data outliers, and future predictions. These all should be in your mind. So what are the steps? There are basically 4 steps of data interpretation. You assemble the information that you need, you develop the findings, you develop the conclusions, and at the end you develop the recommendations. So whenever you publish any research results, they're always going to ask you recommendations, that what in your view, what do you recommend? Why do they ask from you recommendations? Why don't they ask these recommendations from the experts in the field? No, because you are the expert of this piece of research. As much as you know about this data or this research, no one else in the world might know. Okay? So every piece of information that is specific to a certain research project that you are doing, you know everything. You know the challenges, you know all the factors that led to whatever happened. Okay? So we summarize data, we display the results, and we interpret the results. So when we interpret results, what do? We test the subgroup differences. There are different subgroups in a data set, and you ask, the researchers ask for which population are the results representative. For example, if I take a sample of students and I question them again about COVID-19 prevention, this piece of study, these results might be representative for any other group of students or a sample of students that have a medical background. This could also be representative for students who don't have a medical background. But this might not be representative for, let's say, women who are housewives, for example, or working women, for example, because students will be giving an entirely different result compared to women who are married or working women, whatever the case is. So you can not compare apples with oranges. You'll be comparing like with like. So for instance, if I say that the knowledge of COVID-19 prevention was high among medical students of Liaquat National, for instance, I will then compare this knowledge with students of any other college, or I might compare it with students doing their business studies, for instance, and I'll be comparing both of the group of students. So you need to compare like with like, okay? So what could have influenced the results? There are many reasons why the results that you got in that way. We'll talk about that also, and how to interpret the results in a context. So you're going to look for overall pattern and then deviation from that pattern. So, and you look for extreme values, which are known as outliers and gaps. You locate the center and the spread of any distribution, and you'll compare graphs with the same scale. You will be looking for maximum and minimum values in any piece of data that you have. This is called interpretation of data. So confidence interval, I hope that you guys know about confidence intervals. They are actually values that show that your data is within confident enough that your data is within the range of that what is expected. Okay, so first we'll talk about what are the subgroups. There could be in your entire data set, there might be males and females. Okay, there might be age groups, these are subgroups. Okay, there might be 25 to 34 years, 35 to 44 years, and so on. There might be people of different countries, these are all subgroups, and we try to identify a difference between these subgroups. For example, again taking the example of COVID-19 prevention knowledge. We test the knowledge of medical students, okay, and we test the knowledge then based on their gender. That did males have more knowledge or did the females have more knowledge, okay, compared to each other. And we'll talk about attitudes and practices also. Were the males practicing more hand hygiene or the females? Then we can also talk about age groups of all the males and all the females, for instance, or the entire sample. Kis age group mein what was expected and what this age group is not appropriate for this type of study. But you can do it on, for example, women. Women who are working women, for example, you are comparing the working women with how women were staying at home. So you are comparing these women. Okay, then there again two subgroups, and then you'll be comparing their age groups also. That are the younger females more conscious about their hand hygiene and about their practices and about the knowledge of COVID-19, or is it the other way around? And then you can compare between countries also. So the question is, are they different? Do males have a different practice compared to females? The answer is you look at 95% confidence interval. So confidence interval actually tells you the statistical significance of any data. Okay? So if the confidence interval, the values of confidence interval, they overlap, that means they are not statistically significant. So for example, I see there is a difference between male and female practices regarding COVID-19 prevention. But the CI show that it is not statistically significant, so that result of mine will not be of great importance compared to the result that is statistically significant. That there is a statistically significant difference between the practices of males and females regarding COVID-19 prevention. So we'll talk about how we do that. So there are participants who are overweight. Okay, so there are males who are 16.4% overweight, and there are females who are 12.6% overweight. So can we say that males have an increased weight compared to the females? Can we say that? I would appreciate if you could write it in the chat. Yes or no? Can we say that the males have a higher weight compared to the females here in this example? Come on, anyone? Anyone? Are males overweight or are females overweight? Who has the greatest weight? Males or females? None? Why do you say that? Someone has to have a greater weight. सबसे पहला question है, it's very simple. Do males have a greater weight compared to the females, or is it the other way around? I'm just asking this simple question. Males, very good. इस डेटा से आपको यही लग रहा है कि 16.4% males are overweight? Yes. ठीक है, thank you, Sarosh. Both are overweight, but males are in greater ratio. Yes. Though both are overweight, but compared to the females, now I'm just asking if there is a difference between the weight of the males and the females, or if males are overweight, they have a higher weight compared to the females. That's my only question. Okay, the next question is, there are just few people answering. I might say that there's just 1 or 2 persons in answering. I need all of you to chip in and give your answers, because I'll be having multiple questions throughout the session. So here I say that the participants are the males have 16.4%, they are overweight, and the females are 12.6%. By seeing this, I can say that males have a higher weight compared to females. But if you see this, 16.4%, this is the range of the CI, of the confidence interval. It's 14.5 to 18.2. This is the spread of the data. This actually shows the minimum value and the maximum value. Okay? So there were some people, some males who had a weight of 18.2%. They were 18.2% overweight. And there were people who had males who had 14.5%, they were 14.5% overweight. Okay? So now this 16.4% lies in between here. Okay? 14.5%, then you have 16.4%, and then you have 18.2%. In the same way, when you see females, 12.6%, what is the CI, confidence interval? What are the values of the two extremes? It's 11.4% and 13.7%. So you have 12.6% coming in between. So remember, as I said earlier, if the CI's confidence intervals, they overlap, if they come in that figure, if they come in between the minimum and the maximum values, you would tend to say that they are not statistically significant. Okay? They're not, there is a difference between males and females, their weight, but it's not statistically significant. So here, if you see this, I start from 11.4 to 18. Okay? This is the range. So this is for the males. It's actually for the females. So this circle shows the data for the females. So the lowest value is 11.4 and the highest value is 13.7. And your value 12.6 comes in between. So it means that it is not statistically significant, the difference. And then you see for males, the lowest value is 14.5 minimum value, the highest value, maximum value is 18.2, and 16.4% comes in between. Okay, this is how you interpret the confidence intervals. Participants who have raised blood pressure. So we are asking if there is a difference between the males and the females having raised blood pressure. So here 8.4% males had increased blood pressures. Okay? But again you can see that 8.4 lies somewhere in between 5.4 to 11.4. This is the minimum value of the confidence interval and this is the maximum value 11.4. This is how you interpret the data. Otherwise, when you see females have a higher blood pressure compared to the males, that's 11.2 compared to 8.4. However, when you see, the confidence intervals, you see that even females, when you see them, the value lies between 9.2 to 13.2. This is how you interpret the data. This is for the males, 5.4 to 11.4. These are the minimum and maximum values, and your 8.4 value lies in between them. The same goes for the females. 9.2 is the minimum value of blood pressure and 13.2 is the maximum value. And 11.2% lies in between them. So what are the questions that need to be discussed? What population are these results representative for? The ages, we don't know what age group was taken in this case. And regional coverage, what regions did you cover? Did you cover the urban setting or the rural setting? What ages did you take? Did you take girls, and are you comparing girls with men? Or did you take boys and are you comparing girls with men, these boys with women. Who are you comparing? What was the response rate? Did only those people come to you who had raised BMIs? For example, you conduct a study and you want to see, again, COVID-19. You want to see who has better knowledge compared to males and females, who has a better knowledge regarding prevention of COVID-19. You might only have those students who actually have someone who died because of COVID-19. Otherwise, the other people might not be so interested. There are many people who still say that it doesn't exist, it's just conspiracy or whatever. Okay, there will be people responding to you in that way also. Those people might not even respond. Okay, they'll be staying away. Can any information be obtained about persons who do not respond? Please remember, the non-responders are most important. How did you take your data? Did you encourage them to speak about their views or not? Like, for example, people with higher BMI, they came to you, or people with whatever weight they had, they came to you. There were some people who did not come to you, who did not respond to the questions, who were not interested in filling the questionnaire. So, for example, if there was an online questionnaire, who are the people who tend to answer the question more often, or the questionnaire more often? It will be those people who probably have some person in their household who has a raised blood pressure, or who has who is overweight, okay? Or a person who wants to control his or her weight because of certain, for example, that person is suffering from a certain condition, some heart disease, or that person has diabetes, for example, or some other chronic disease, because of which that person becomes more inclined towards your questionnaire and then is more likely to respond to your questions. Okay? The other people who are fit enough, they might not respond. Or probably who are the fittest, they might come and respond to your questionnaire, but the people in between, they'll not be interested. They'll just say that we're the way we are, it's okay. You'll be encountering people, such people as well. What could have influenced the results? Was it your bias? Was it some other reason? Did you collect data only from those people who had overweight? Okay? Is it possible that results were over or underestimated? Okay? The true values, they did not come in front, and the data was over or underestimated. Every study has certain limitations. There might be seasonal variations. There might be social desirability, as I just said. There might be missing values. You did not take the data and then you have missing values. There might be people who might be filling in certain questions and एक दो questions छोड़ दिए. For example, household income. Many people tend to not answer that question. What was the method used for sampling and for data analysis? Was that rigorous enough? How did you collect the sample? Was it a random sample or non-random sample? How did you collect it? Okay? So seasonal variation, for instance, if we say that people, let's take day and night variation. For example, you're at a supermarket during an extremely cold winter night. Did you get data enough or not? You want to talk about, let's say, the lockdown. You want to talk about how people, what did people face during the lockdown? Their anxiety levels, for example, during the lockdown. Where did you take the data from? Did you take it from a hospital setting? You will have only ill people coming in the hospital when you take such data. So if you want to ask such general questions, you might go to a superstore. But if you're going at night during cold winters, you'll only have people who are very strong, not aged, not very young, coming in your sample. So is that sample representative of the entire population that you're referring to? No. Okay? Social desirability, for example. You have a certain social question regarding let's say weight, ठीक है, body weight, BMI. So there are certain people, as I said, people who have higher weight, they might want to reduce their weight, and then they're interested in your study. Or people who have excellent weight, excellent BMI. There might be people, those people might respond to your question more compared to the people who are just in between. So if possible, the results should be put in the context for interpretation. So you compare your results with previous surveys in the same population and compare with surveys using the same methodology in other populations. Okay? So you're going to compare, if you want results, you want to look at the broader picture, that we have these results, what was found earlier, what were the results when we took this data, when this data was taken earlier, or you use different methodologies. For example, you don't go for a questionnaire based methodology. You don't go for you go for more quantitative measures where you take the data of the BMI, you actually measure BMI of the people, and then you there was the same study done with just a questionnaire, okay? And that study did not have the mention of BMI. So your study in other way is different compared to different previous studies. So prevalence, mean and medians, they are used as summary statistics for reporting the steps in data. Confidence interval should be provided with prevalence and mean values. Interquartile ranges here for median. When you use median, remember whenever you have skewed data, you will use interquartile range. Otherwise, you will use means and standard deviations. Okay? And the most effective ways of presenting data are in the form of tables and graphs because they give a quick picture of the data. And results should be interpreted with regards to accuracy, representativeness, and the methods that are used, and if possible, the results should be compared to other surveys. So there is a difference between association and causation, as I mentioned earlier. Association is a specified health outcome that is more likely seen in people with a particular exposure. Is there a link? Association is actually a statistical relationship between two variables. So you say that two variables are statistically significantly associated with each other. Compared to this, causation means that the exposure actually produces the effect. Okay? You did not observe hand hygiene, you did not observe social distancing, so you contracted COVID-19. That means these practices of yours led to the disease. Okay? However, there might be an association. For example, you were at a certain ward. Now let's say you were rotating in a certain ward. Some people contracted the infection, some people did not contract the infection, and they all were covering all the SOPs related to the infection. Then you say that there might be an association between your working in that ward and contracting the infection. So it can be, the causation can be the presence of an adverse exposure, for example, increased risk from working in a coal mine, using illicit drugs, or breathing in second-hand smoke. Causative factors can also be the absence of a preventive exposure, such as not wearing a seat belt led to a collision, or not exercising led to increased BMI. So association, should not be confused with causality. Two things might be associated, but they might be causal or they might not be causal. You cannot say with 100% surety that they are causal. Association does not mean that one thing caused the other thing to happen. For example, suppose we observe that people who daily drink more than 4 cups of coffee have a decreased chance of developing skin cancer. This is nowhere in any terms associated They don't have this is not a causation. This does not necessarily mean that coffee confers resistance to cancer. One alternative explanation can be that people who drink a lot of coffee work indoors for long hours and thus have little exposure to sun, which is a known risk factor, okay, for skin cancer. So people will be sitting indoors, they'll be consuming coffee, and then this is the reason why they might have lower chances of developing skin cancer. So an observed association may in fact be due to the effect of one or more of the following. There may be a chance, bias, confounding, reverse causality, or true causality. So what are the types of association? There may be spurious association, which is not true. There may be indirect association, as I just mentioned. You're consuming coffee. It was because of this coffee consumption, because you stayed indoors, your work was mostly indoors. So you won't see a laborer who's working outside in the sun, or a person who is doing construction outside, consuming so many cups of coffee compared to a person who is working in the office, for example, a banker. So his or her profession is indirectly associated with the cause. So this is why you saw an association. And then there's direct association, one-to-one causal association, or multifactorial causal association. So what are the measures of association? You have different measures. There are odds ratios, there are relative risks, there are attributable risks. We've already talked about these. So causation takes one step further. It says that any change in the value of one variable will cause a change in the value of another variable, which means that if one variable makes it makes it happen. It is also referred to as cause and effect. सबसे पहले causation means that two events appear at the same time or one after the other. And secondly, it means that these two variables not only appear together, the existence of one causes the other to manifest. If one is not present, the other cannot happen. So these are causal relationships. So a factor leads to a disease, and then this is an indirect association. A factor which had two steps in between led to a disease. So if a relationship is causal, four types of causal relationships may be present. It may be necessary and sufficient, necessary but not sufficient. The factor might be necessary but not sufficient to cause the disease. It may be sufficient but not necessary, and it may be neither sufficient nor necessary. So what is the evidence of causal relationships? In 1840, Hennel proposed the postulates for causation that were expanded by Koch in 1880s. The postulates for this causation were as follows. The organism, for example, Mycobacterium tuberculosis, it has the bacterium always there. Whenever you have TB, you have Mycobacterium in your body. It is always there. The organism is not found with any other disease. You won't find this in, for example, let's say SARS. You won't find this in COVID. And the organism isolated from one who has the disease and cultured through several generations produces the disease in experimental animals. So Koch added that even if an infectious disease cannot be transmitted to animals, the regular and exclusive presence of the organism proves a causal relationship. So what are the criteria for causal relationship? There should be consistency. You'll always find the same results. There should be strength, dose response. As you increase the quantity of the microorganism, so will the disease be more aggressive. Specificity, temporality, and coherence, we'll talk about these later. And then there's Hill's criteria, which has strength of association, consistency, specificity, temporality, biological gradient, plausibility, coherence, experiment, and analogy. You can all go to, you can refer the book Leon Goddess, which is a book of epidemiology, where you have a detailed description of these criteria. Then you have misinterpretation of data, where correlation is mistaken for causation. You have confirmation bias, and then you have irrelevant data. Okay? So when you have correlation mistaken for causation, this tendency of data analysis it is to mix the cause of a phenomenon with correlation. It is the assumption that because two actions occur together, one caused the other. So what's the remedy? Attempt to eliminate the variable you believe to be causing the phenomenon and then see if the other thing happens or not. Confirmation bias. When you have a theory or hypothesis in mind, but are intent on only discovering the data patterns that provide support while rejecting those that don't.